Pancreatic cancer has the highest mortality rate among all major cancers, with recent research suggesting a dangerous gap in knowledge of pancreatic cancer among adults under 50. This is of grave concern as cases in this age group continue to rise, with many not aware of the warning signs. Joining us now to discuss more about these signs is Dr. Madhapa Kundranda, a gastrointestinal oncologist and division chief at the Banner MD Anderson Cancer Center. Doctor, thank you very much for being here.
Thank you, Steve.
Yes, the most basic question.
Please.
What does the pancreas do for us? Why is it so important?
Correct. So the pancreas is an organ that actually helps with multiple functions, including regulating your blood sugar, including helping with some of the digestion. So it depends on what we call as the exocrine or the endocrine functions of the pancreas. So it is a vital organ when we think about the digestive tract.
So let's talk about why there is, I want to ask it this way, that we've become more aware of the idea that pancreatic cancer is such a killer. Is that because people are not paying as much attention? Is it because these folks under 50 aren't aware of the symptoms? Big question there, broad question, but tell us why some of these reasons, because it doesn't seem like it's as common as some of the other cancers, but it is more of a killer than some of them.
Correct. You're absolutely right about that. So number one, the numbers are between 20 to 25,000, but the mortality per year is comparable. So that's the reason it's a problem. It's in one of the top 3 to 4 killers, both in men and in women, but it's within the top 10 in terms of incidence, right? And it is a combination of not having a screening test. The ones where we made the most impact are cancers such as the prostate. We have a test to screen for that. Breast cancer, you have the mammograms, colonoscopies for colon cancer. So we don't have a universal test that we can actually utilize in all patients to screen them for pancreatic cancer. However, with that being said, with the higher risk patients, right, the ones that have a genetic syndrome, ones that have cysts in the pancreas, those we tend to follow them a lot more closer. And in those cases, and the whole purpose is you try to identify this sooner and you can potentially get a curative intent. Because even in 2024, all of 100 patients that we diagnose with pancreatic cancer, it's less than 20. The realistic numbers are less than 10 that can potentially be cured of the disease.
Okay. Well, what are the symptoms? What are there things people should be looking out for if they're feeling a certain way? And then if they do feel like they have symptoms, what's the next step? Do you see your family physician? Do you try to see a specialist?
Absolutely. So that's the tough part, because the symptoms can be very vague. And that's why it's called the silent killer, right? So one of the most common symptoms that we see in the clinic are patients who come in with jaundice. And typically it's painless jaundice. Now a lot of things can cause that, right? Even if you have a stone in your bile duct, it can cause painless jaundice. But the biggest thing is when you have symptoms such as jaundice that still could be too late when patients are diagnosed, right? And that's the problem. The most common symptoms are weight loss, which is unintentional. You could have just non-specific GI symptoms like abdominal pain, abdominal cramping. Some of them have this boring pain towards the lower back. So some of them actually mistake it for back pain. So it's all of these non-specific symptoms. That's what makes it so difficult to pick it up in time.
Well, it must make it difficult with so many different kinds of illnesses because there are so many shared symptoms.
Exactly. So that's why you can't really pinpoint it and say, this is exactly what's causing this, because this whole barrage of these non-specific, what we call GI symptoms, and a majority of those symptoms can be benign.
Are there people who might be more susceptible to pancreatic cancer? You mentioned genetics, but in terms of diet, exercise, anything like that, are there things that people should be looking out for?
Absolutely. So in the context of patients who are more susceptible to that, yeah, the genetic component is a small component, about 2 to 5%, right? And some of these other things that we pick up, now almost any patient that comes into the emergency room gets a full body scan, right? So sometimes we do pick up these pancreatic cysts, and some of these cysts can turn into malignancies. So when we pick those up, we tend to work them up at Banner MD Anderson, and then we come up with a plan in terms of what your surveillance would look like, which is a little bit different in terms of somebody who doesn't have a pancreatic cyst when there's no screening test per se.
Let me ask you a research-related question then. You mentioned colonoscopies, which of course people get on a regular basis, prostate exams for men. What would it take, or are you seeing progress, or are you hearing about progress that maybe there will be, especially because it's such a silent killer, a test for pancreatic cancer more coming up in the near future?
Yes, definitely. I think there's a lot of progress that's being made. in the context of whether it's what we are looking at the DNA of the tumor to see if it's circulating in the bloodstream to be able to pick that up early. We have other modalities wherein even our screening modalities, such as the imaging modalities, endoscopic ultrasounds, all of these, the techniques are getting much better. We're getting savvier in terms of earlier diagnosis, and that certainly has been helpful, but we're not there yet.
Less than a minute or so to go. I hate to ask a sort of a morbid question near the end of our conversation, but when someone is suffering from pancreatic cancer, just how painful is it? Is it one of those where that it hits very hard and also hits very quickly at the same time?
And it really depends on where the tumor is located. So if you have it at the head of the neck of the pancreas, that's when it presses on the nerves that causes the pain. If you have it in the tail of the pancreas, you might not have any pain. But I think it's more important to recognize the other symptoms. It's what we call cancer cachexia, right? Wherein you're losing weight, you're losing muscle mass, your appetite is low, you're getting weaker. Those are the ones, the symptoms that we need a whole team to work with you, with a dietitian, with a nutritionist, with physical therapy to be able to work with you through all of that to basically optimize your quality of life in those situations.
Doctor, thanks so much for the important information. Really appreciate your time today.
Very welcome. Thank you.